Wishing you all a very good day. This is Dr. Chandrani Chatterjee from West Bengal. Today I will be talking about respiratory ailments, commonly asthma and COPD. So as we know that respiratory ailments are on the rise since the onset of COVID. After post-COVID, many people have developed new onset asthma. More people are now being diagnosed with COPD as well. Previously, there was very less awareness about these ailments. So I will be speaking a few words regarding them. So what is asthma? Asthma has a genetic predisposition. It is a disease in which you can have a myriad of symptoms. It is not just shortness of breath. Even a small chest tightness, nocturnal cough, the cough that is difficult to cure even by multiple treatments, that requires a long time to be treated, requires steroids for its remission. These are all features of asthma. And the treatment of asthma has to be started early, because if you don't do it, then it will progress to COPD later on, and that will cause a structural damage, and your lung will never get back to its normal state. Okay. And the treatment of asthma is done by inhalers only, inhalers and inhalers only. So that is the mainstay of treatment, not any oral tablet. First point. Okay, and speaking a few words about COPD. COPD is a more, a chronic disease caused by cigarette smoking, exposure to pollutants. And by exposure to pollutants, I mean it can also be due to biomass fuel exposures like the coal. If you use coal for cooking, then the smoke that is generated from them can also cause COPD. Industrial level smoke, it can also cause COPD. So we have to be aware of these factors and use a mask as much as practicable. And if you get diagnosed with COPD, and the common symptoms of COPD are much like asthma, except that asthma is mostly episodic. That is, it has a certain exacerbating factors like in the winter season or any infection, when the symptoms flare up, and in the meanwhile the symptoms are normal. But in COPD, there is a baseline symptom throughout the year, and these aggravating factors, they just increase the symptoms. And every time that you get an aggravation, which is also called exacerbation, your lung does not return to its previous healthy functioning. Each exacerbation is like an attack to the lungs, very similar to an attack on the heart. So it is very important that we address these issues, and that you properly seek treatment. So if you have any of the symptoms like shortness of breath, cough, chest tightness, a certain sound comes out while you breathe, which is also known as wheezing, then seek consultation with an experienced pulmonologist immediately. Thank you.